How do muscular dystrophy diagnostic tests work? Diagnosing muscular dystrophy is a detailed process that combines clinical evaluation and specialized tests. It begins with a thorough medical history and physical examination. Doctors look for symptoms and assess muscle strength to gather important information. One of the first tests often performed is a blood enzyme test. This test checks 4 levels of creatine kinase, or CK, which is an enzyme released by damaged muscles. If the CK levels are elevated, it suggests muscle damage and may indicate a muscle disease, including muscular dystrophy. This test serves as an initial screening tool. Next, genetic testing plays a crucial role. Blood samples are analyzed to find mutations in genes that are known to cause different types of muscular dystrophy. This test is becoming the primary method for diagnosis due to its accuracy and non-invasive nature. It can confirm a diagnosis by detecting specific genetic changes. In some cases, a muscle biopsy may be necessary. This involves surgically removing a small piece of muscle tissue for examination under a microscope. The biopsy can show characteristic changes in muscle fibers and protein content. For example, in Duchenne or Becker muscular dystrophy, there may be an absence or reduction of dystrophin protein. Although muscle biopsy is becoming less common due to advances in genetic testing, it remains valuable when genetic results are unclear. Another important test is electromyography, or EMG. This test measures the electrical activity of muscles by inserting a fine needle electrode into the muscle. It helps distinguish muscular dystrophy from nerve disorders by showing abnormal electrical patterns in the muscles. Nerve conduction studies are also performed. These tests evaluate how well electrical impulses travel along nerves. While muscular dystrophy primarily affects muscles, these studies help rule out nerve disorders that can mimic muscle diseases. Additionally, some muscular dystrophies can impact heart and lung function. Therefore, tests like electrocardiograms, echocardiograms, and lung function tests are conducted to monitor these organs. This monitoring is essential for guiding treatment decisions. Overall, the diagnostic approach integrates clinical findings with biochemical, genetic, and histological data. This comprehensive evaluation is crucial for accurately identifying the type and severity of muscular dystrophy. It also aids in planning appropriate management and genetic counseling. Always consult experienced healthcare professionals for diagnosis and care, as personalized assessment is vital.